Hello, welcome you all again. I'm really happy to see you and meet you through this video on the physical examination, which is a basic clinical requirement. So, in this, we are going to deal with the PERRLA assessment in the eye. I know many of you are very much doubtful and fearful on how to do the pupillary assessment. So today we'll be seeing in detail on how we can do the PERRLA assessment if we are going to deal with any sort of adult health nursing patients, might be in a medical ward or surgical ward, anywhere. We'll be doing the assessment starting from an ER or even into an ICU unit. So we'll see what is the major criteria and major area what we are going to focus on PERRLA. So yes, before we go into the deep knowledge of PERRLA assessment, what is PERRLA? PERRLA is the expansion of how you can expand, that is how the pupils are equal, that is you will be doing a bimanual examination, both the eyes, so whether both the pupils are equal, whether they are round or irregular, and how they react to the light in case of a direct exposure to the single pupil, or when you pass the light to one eye, how the other eye responds. So reaction to the light as well as how far they accommodate with the um, light source which is around the ward, as well as during the pupillary assessment how the pupils accommodate. We'll see in detail on how a PERRLA assessment looks like. So yes, I am supposed excited on what is PERRLA assessment, and I also think the same that you are also too excited. Okay, let's see. So first, visually we are going to check the client's pupil, especially the shape and the relative sizes. So the pupillary shape as well as the size is being compared from one eye to the other eye. So to do this, how do you do it? Yes, we can place the patient in a dim room and we are going to swing the handheld light or torch across the pupils to check the response to light. Meanwhile, we are going to ask the client to look onto an object, might be a pen, and follow it as it is moved closer and farther, as well as sideways, to check if the pupils can change to different focuses as well as different distances normally. So going into deep of what are pupils, these are the black circles which is present in the middle of the colored part of the eye, that is the iris, that let the light so that the client can see. So because of this dilation, especially you would have come across, like when you go to a direct exposure on a sunlight on a sunny day, and when you come to a dim room, you feel like might be the house or the classrooms are very dark after moving into a direct sunlight. It's because your pupils are more dilated on exposure to the light, and when you come to a dim room, it is taking its own time for accommodation to that particular light source which is being changed from the environment. So here the pupil size and shape will be determined before testing its response to light and accommodation. To do this, the patient is being placed on a dim light as well as a bright light shining on the pupils, and we'll be doing a comparative study on both the right and the left eye, how far it is doing the main accommodation. So coming to the pupils, the normal pupils are about the same size of both the eyes, but you can see that 1 in 5 people have bigger than the on others because they might be having a condition called as anisocoria, which is a harmless condition. As you can see, this is predominantly seen in aging factors, but it can also be a pathological sign if the client is having any health issue related to brain or blood vessels or nerves that is very much accompanying the optic area. And if the client has a normal or physiological anisocoria, his pupils will react to changes in light the way they should be. So let's go into deep on how the pupils work after passing the light. So the following tests are needed to find out whether anisocoria is present. So either the patient can go in for doing a detailed MRI, angiogram, CT, angiogram or Doppler ultrasound. But there are certain conditions that can change the size of the pupil, such as in case if there is a torn or blocked blood vessel in the neck, or might be an aneurysm in the brain, or it might be a nerve problem in the brain, or mostly reacting to medications such as eye drops or motion sickness patches. So let's get in detail on how the pupils are said to be round. So pupils of both the eyes are always perfectly round in circles like a keyhole, and some causes like where abnormal pupils also can be seen like a keyhole or a cat's eye, which is mainly a condition called as glaucoma, which is present in the iris or due to any cataract surgeries previously, or patient had any injury to the external eye, especially to the cornea or the iris, or due to any formation of collateral blood vessels, or due to a condition called as tadpole pupil, which is mostly seen in patients with migraine, and patients with rare brain disorders can have abnormal or irregular shape of pupils. So now coming to the accommodation, how the pupils are reacting to light and how it is accommodating. So light, so how we do is that we do perform a swing light test. To do this, a small light is being passed with narrow beam and it is being shined into the one eye for about 3 to 4 seconds and then into the other eye. So the normal pupils will always shrink in reaction to the bright light, that is the constriction you can see, and both the pupils should get smaller together even when the light shines directly into one eye at a time. That this statement is saying that like when you pass the light to one right eye, might be the left eye is also getting the reaction, that is it is getting constricted. Similarly it can be done vice versa. So both the pupils should get bigger, that is again it is dilating once it is in a dark room, or might be when you remove away the torch from the patient, then the pupils again get back to its normal position, that is dilating. And then now coming to the accommodation, the pupils will also constrict and get smaller when the focus of an object is very close to the eye, especially when you bring very close to the eye, the pupils constrict, and when you take it far away, the pupils will dilate. But there can be abnormal in the pupillary reaction in light and accommodation if there is any problem such as any injury, infections to the optic nerve, a tumor pressing on the optic nerve, or might be a glaucoma, which is a condition where you can see there is increased intraocular pressure, or might be any damage or infection to the retinal layer, which you all know that is the retinal layer is acting as the main organ of sensory input in eye, as well as you can see if there is any severe macular degeneration, such as there will be loss of central vision. As you can see in this picture, the patient will have a loss of vision in the center when compared to the periphery regions. So coming last but not the least, that is pupil, how it is looking abnormal and what are the possible conditions it can dilate. So when you go into the first picture, you can see that the right eye is very much dilated. It is very close or equal to the cornea, and the other eye is very small or maybe small constricted. Here you can see that it is unilateral, that is it is not bilateral. Bilateral is both the eyes. Unilateral, only one eye is dilated. So here you can see the dilation. So to one eye you can see the dilation, but the other eye is not having that much dilations. So unilateral dilated pupils is mostly seen in a case where there is third nerve compression, mostly due to any cause of hematoma. And then on the second picture you can see both the cornea is very close, that is you can see the dilation of both the eyes is very equal. So here you call it as a condition called as bilateral dilated pupils, and it is mostly seen in case of there is a midbrain injury. And coming to the third picture, you can see that there is irregular pupils, that is here the pupils is round on the left when compared to the right, and you can see it is not of a spherical or oval shape, so hence you call it as a irregular pupils. This is mostly purely due to any orbital trauma. And on the fourth picture you can see that the gaze is being deviated, that is both the cornea is going towards the right side, and this is mainly we call a condition called as conjugate gaze deviation, and this is mostly seen in a case where there is a frontal lobe lesion, or you call it as a frontal lobe malignancy. And in case of the last picture, you can see that there is a pinpoint pupils on both the eye, which we call it as small or pinpoint pupils, and it is mostly obviously due to any intake of poisoning, especially due to over administration or overdosage of opioid administration, or it can be of due to any injury to the brain, especially to the pontine region. Hope you all are clear with the abnormal pupil dilations, but usually the pupils must be equally round and reacting to light as well as accommodation. And that's all for today's session. Hope if you have any doubts in this video, please try to give your comments as well as your suggestions. And if you want any other topics, please feel free to put onto the comments box so that I can prepare myself and deliver the maximum inputs to you. Thank you all for your patient listening. Please don't forget to subscribe as well as to follow my channel, and I'm happy to have you as my the resource person who is listening calmly over there. Thank you so much.